Hello, good morning, everyone, and welcome to Oraposium 38.0. It's so good to have you join us this morning. My name is Nguchika Charity, a fellow Orapo College of Scholars. I'll be your moderator for today. If you've not shared our flyer this morning, kindly do so. And we are starting off immediately. This morning we'll be having one of us speak to us on an interesting topic, health economics, a system approach. But before we dive into that, for the benefits of those that will be seeing this recording later, and for those that will be joining us for the first time, this is Orapo Community, and this Oraposium is brought to you by Orapo. Who are we and what do we do? What is our mission? Orapo is an acronym for Oral and Public Health. Can anyone still hear me? Hello.
Yes.
Okay, thank you. Orapo is an acronym for Oral and Public Health. So this community is for oral health practitioners and for public health practitioners. Okay, so it's for everyone in the health sector. Okay, is an international independent oral and public health information, education and research organization incorporated in the Republic of Gambia. We exist to give underserved populations swift access to information, education and research in the underserved area of oral and public health disciplines. Our mission is to support the development of oral and public health manpower, services and consumer products in resource-limited contexts by catalyzing aggravated access to information, research, learning, and innovation in underserved disciplines of oral and public health. We work in unison and we have 5 entities in the Oracle family which work in synergy to execute the mission of this organization. And these entities include the Oracle School. If you've gone through our short courses, you would understand what we mean by Oracle School. Like we give affordable and flexible oral and public health learning opportunities to health personnel to upskill in their various fields. We also have the Oracle journals, and we also have the Oracle literature review. You can publish your journals, your articles using our services. Then we have the Oracle community where we give out free lectures on interesting topics chosen by the members of the college. Then we have the Oracle College of Scholars, where we train disruptors and we send them out to the society in their various fields to make remarkable difference to the world. So if there is any questions you have about Oracle, you can visit our website www.oracle.org to get notified. And also, if you have any confusion, you can do well to send me a message, or you can send the lead mentor a message. Thank you very much, everyone, for joining. So this morning, without wasting so much of our time, we'll be inviting one of us, a renowned dental therapist, to speak to us on the topic Health Economics is System Research. Our presenter today is a member Oracle College of Scholars. He's also a dental therapist. He's in the Division of Public Health, and he will be speaking to us this morning on Health Economics, a System Approach. You're welcome, Mr. Okpkwasili Amala P. Promise. why I share the slides. So please, before the program begins, this is just to inform us to, if you are in a noisy place, you can as well mute yourself so you can only hear the presenter speak to avoid interruptions and distractions from your background. Okay, and during the course of the presentation, you can reserve your question to the end until the end of the presentation, and you'll be given time to ask your question and it will be responded to. Okay, please, no interruption during the presentation, and we look forward to seeing all of you at the end of the session. Thank you. Mr. Promise, please, can you go ahead while I share the slide?
All right, thank you very much, the moderator. Having been introduced by the moderator, I wish to proceed. Good morning, everyone. Just like she rightly pointed out, we'll be discussing on a very important topic in the health sector, which is health economics, a system approach. Let's go to the presentation outline. For the presentation outline, we have the introduction, we have the aims of health economics, we have the principles of health economics, questions health economics are curious to ask, 6 key areas to approach healthcare economics, who should study health economics, importance of health economics, conclusion, then the reference. By introduction, World Health Organization define health as a state of completely physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health economics is the study of scarcity and how it affects the use of resources, the production of goods and services, the growth of production and well-being over time, and many other important and complicated issues that affect society. It looks at how people, business, government, and countries choose to use their resources. And while talking about economics, is something that we are very familiar with. You know, when we talk about economics, basically what comes to our mind is wants, the needs, and most importantly, the scarcity as regards to the populace or the population within a particular area. And we are talking about economics and health. It says it's an applied field of study that examines and finds system-based solutions to make healthcare more equitable, accessible, and affordable for all. Now, having understood economics as the study of scarcity, now health economics is just a systematic way that brings solutions to make healthcare more equitable, more accessible, and more affordable to all. You know, you can, most times, especially when talking about economics, you are talking about scarcity. So health economics finds a way to bring a balance between making sure that this person is satisfied and the other person at the other end is being satisfied. And by that, you are bringing equity, accessible, and where they can afford this. And it also applies the theory of production efficiency despite the competition and regulation to better inform the public and the private sector on the most effective, cost-effective, and equitable course of action. Now, in as much as you are finding a way to create a balance, you are also finding a way to breed competition, because you know that in every society, competitions are ongoing. We have the healthy competitions, we have some that are not healthy. But health economics brings a balanced way to regulate all these things, both the production, both the disparity, both the efficiency, and both the competition. So it's not just something that is happening in public and not happening in private sector. No, it's a way that is something that brings equity to every member of the society, particularly as regards to the health. Such include the economic evaluation of new technology. Yes, this is very important because we know that technology, we are now into vast paradigm shift of innovations and technologies and what have you. Things are being manufactured day in and day out, and health sectors are not being left behind. It's all encompassing. Now we are talking about AI, artificial intelligence, and even how it affects the healthcare system, both the way it is beneficial and the way it's not beneficial. Because when you're talking about technology, you're talking about ways that healthcare can be improved via using technology. And now robots have started taking some of our jobs, but health economics is a way that brings balance to it. Now, as well as the study of appropriate prices, yes, you cannot be overtasking this member of the society and you are not overtasking this person. No, it's a way that brings balance, that in as much as we are talking about the improvement in technology, yes, which is very important, there should be a way that brings balance to the prices. The anti-trust policy, just like I pointed out, the government, the non-governmental organization, the World Health Organization, all the policy making bodies as regards to health, how they behave, the policies that they make as regards to the health. This is very important to the aims of health economics. Number one, to understand the behavior of individuals in relation to their health. Yes, is a study that deals with individuals, how we behave to our health, how a common man in the society behave, or how they attend to their health, to understand healthcare providers and how they dispatch their duties. Yes, the first one is talking about health providers, noticing ways that individuals, or what you call their patients or their clients, how they relate to their health. Then the two part of this is now those individuals to understand the healthcare providers and how they dispatch their duties, which is also very important. So it does not work in a way that this person is not monitoring this person, or this person is posing superior over this person. No, it's a way that brings balance. That in as much as you are monitoring me or you are regulating me, I also have a way to regulate you and even the services that you claim that you offer. Now, to improve collaboration between the public and private organization, this is very important. You have a system for referral. If my hospital cannot read this, if my establishment cannot read this, I have a way that I can, just with card or with email or what have you, just send the person to an organization that can treat a particular ailment, to help government and other policy-making bodies to make policies that will be beneficial to both health care providers and the individuals. Now, this is talking about the policy-making bodies, which is very important. As much as they are making their policies should strike a balance that will be beneficial to both the demand and the supply. By talking about the demands, the people that need, the individuals that need the healthcare, and the supply side, the healthcare providers that provide those services. So it's very important that we should, have this aim as we dive into this study. The third slide, principle of health economics, the nation of scarcity. That's number one principle. I listed out about 5 principles here that is very important that we discuss. Number one, the nation of scarcity. Number 2, the opportunity cost. Sorry. Number 3, the discounting. Number 4, equity. And number 5, time horizon. Then you are talking about scarcity. Just like I pointed out before, once you are talking about economics, you are talking about scarcity. You are talking about relationship between scarcity, between want, between needs, between the individuals. Now, scarcity in healthcare system are not enough healthcare resources to meet all the health needs that people have. So we have to choose which needs are met and which one is not being met. Now we are talking about, because we know that just like in a case of maybe an accident, there is something in healthcare that is called triage, like triaging. You try to sort out. In economics, it's called maybe scale of preference, yes. But in healthcare, it's called triaging. You try to pick more serious needs, more serious attention to a particular thing. Just like when COVID-19 started, most of every other ailments we are almost shut down. Why? Because the world wants to tackle COVID-19. Also, in the case of accidents, you can also see that in the case of accident, for somebody that has head injury, you are expected to give maximum attention to that person than to the person that just sustained a minor injury on the leg. So we are talking about notion of scarcity here. We should understand that in as much as we are trying to bring balance, the healthcare system, the policy-making body, the government are trying to bring balance, but the population keeps increasing. So one of the principles is to note that we, the healthcare providers, or even the individual that needs the health, should understand that we cannot satisfy all the needs in the society. So we should find a way to attend or to give basic attention to those ones that are very important or that are life-threatening. Then the opportunity cost. This is benefits forgone by particular use of resources. Such resources are scarce relative to needs. The use of resources in one way prevent the use in other ways. Yes. If you talk about this, mostly talk about improvising. They are trying to use this one, not to use the other one. It's a way that you try to forgone a particular need to satisfy another need. For example, somebody that has brain injury and it's learned that the person had brain death. The person is actually, he had brain death. The person can no longer function in as much as those organs in his body, maybe the kidney, the liver, the heart, every other thing is working well. Now, health economics has a way to inform maybe the next of kin or the family of that particular person that this person cannot actually perform. The quality of life is dead, not even optimal. So the opportunity cost here, we demand that although this thing is not obtainable most time in West Africa or in Africa as a whole, but in the Western world, you find a way to harvest such person's organ to save another person's life, to improve, the quality of life in another person. Then discounting in health economics is a fundamental procedure for adjusting future costs and outcome of healthcare intervention to present value. Essentially, this means adjusting for differences in the timing of cost compared to the health benefit. Now, if you talk about discounting, most times people don't actually, when government try to subsidize, or when government, or maybe not just the government, maybe the NGOs, they try to, to bring discount to tackle a particular ailment or a particular disease within the site. Most of the time, people don't know the need. For example, vaccine, the use of vaccine, or even screening. We have so many NGOs now that are going about doing cancer screening for the women, especially the breast cancer and the rest. Some people don't actually know the needs. If you allow them to pay for it, they will not pay. But health economics tries to bring balance to know that, yes, they might not actually see the need now, but in future, they will see the need. For example, somebody that's undergone cancer screening might actually have traces of cancer when it is very small. Now, the timing of the cost of the expenditure is very minimal. as of then, maybe they ask person, just get the card, we are going to do this thing for free. The person might not actually know, but for a healthy person, the person might not actually know what the cost that must have been saved, that particular screening has saved her, by discounting. So people now see the need, even in vaccine, maybe in polio. Maybe somebody will say, my child doesn't have polio. No, but we are not looking at the child at the state of birth. We are talking about 3 years, 4 years, 5 years, 6 years, when the child starts growing up. So all those vaccines, as a result of discounting, so that people can benefit from it in time to against the future cost. Now we are talking about the fourth principle here, the equity, which is very important. This is the fairness in distribution of health and healthcare services across individuals. Yes, this is equity. You are not. Health economics tries to bring a balance between somebody living inside the town and somebody living inside the village. It's quite unfortunate that in most of our towns or in most of the states, that the primary healthcare system are not working. But this health economics, one of the principles, is a way that brings this balance, that if I'm living inside the town, I'm getting these malaria drugs. Somebody that lives inside the village should also get the same quality of anti-malaria drugs. So it brings fairness in distribution of health and healthcare services. Not like you are living in the town, you have an advantage or higher advantage to those living in the village. It should not be so. So health economics finds a way to bring balance to it. Then the time horizon. The time horizon used for an economic evaluation in the duration over the health outcome and costs are calculated. Now we are talking about seriousness in diseases. Maybe for acute, this person suddenly develops stroke. The approaches that you give to that person to make sure that the quality of life of that person increases. The person starts the drugs, the physical therapy, and the rest. All the needs are being spontaneous. You try to, as you are doing the drug part, you are doing the physical therapy part, so that the person can regain his or her quality of life. Now, for talking about the chronic disease, maybe the person has actually gone blind. There is no way you can, medical wise, that sight can't be restored again. So there are palliative ways to start tackling the person so that the person can live his or her own life. Now, to the next questions health economists are curious to ask. How do we put a value on health? Is there really a value for health? How do we put a value on health? Then what factor influence health beside healthcare? Yes, there are many factors that influence health beside healthcare. You talk about diet, you talk about the environment, you talk about the work, the hazard, the work occupation, and the rest. Now, what factors? If we consider all those factors, then we can say that this person is living an optimal life, or even the quality of life of the person can increase, not just when the person becomes sick. Healthcare, we're talking about healthcare, the factors that influences the healthcare. Maybe when that person we are waiting for that person to become sick. No, your environment, the food you eat, even your exercise, all these things, they have a way to influence somebody's health aside the healthcare. Now, what influences the supply and demand of healthcare? Now, you remember I talked about maybe those people living in the village or the rural areas. Some of them don't even have electricity. Some of them don't even have access to road, access to good water. So all these things affect how their health, is being it affects the quality of their life. And by affecting the quality of their life, their health is also at risk. So all these things should be brought to balance. Now, behavior of healthcare providers versus those seeking for health. We have, you have complaint of, I don't like going to this particular hospital. Why? Because of the behaviors of the healthcare, of the health practitioners that works in that particular hospital. And you see somebody, don't go to this. You see a patient, a client advising to this person, don't go to their nurses are not serious, their doctors are not serious. They will just bring you and leave you there and what have you. So all these things are very important, are questions that we need to ask. Even though seeking for health, those patients that we have, how do we respond to them as healthcare providers? Now, what are some alternative approach to healthcare production and delivery? If all these four other things are being put to place, what are the alternative approaches? Are there sensitization that we need to make as healthcare providers? Are there things that we need to provide for them? Are there initiatives that can encourage them to live a more healthy lifestyle? How can we improve the ways in which we plan, budget, and monitor healthcare? Now, most times this is for the policy-making bodies, the federal government, the state government, and the local government. What are the ways they can improve in making budget and even monitor the healthcare of the populace, of the people that they are governing? Now we are going to 6 key areas to approach healthcare economics. Number 1 is spending growth. Number 2, the role of patients. Number 3, the roles of healthcare providers. Number 4, risk and insurance impact. Then benefit design and payment reform. Now, spending growth. This is understanding the drivers of healthcare spending, how spending varies across regions, and how technology can play a crucial role for anyone working in the industry. Now, we talk about technology before. Now, I still want to bring it up again. Spending growth. We are talking about the ways we spend our resources. Now, technology has a way of making sure that more people are being attended to. For example, in dental sector or in dental department, you talk about the preventive dentistry, then the dental therapist. There was a time it was just a manual instrument that you used to work. And by using manual instrument, you will take more time in working on a patient. But now ultrasonic scanners are out. You can at a go, you can work as many patients as possible. It increases your productivity. So in the spending growth, it influences the way the hospital or the healthcare sector, how they spend and the impact of their spending. Then the role of patients. They achieve this by the choice they make, especially in preference concerning their prescription, choice of treatment, seeking too much or little care, or opting for elective surgery. Now, patient also has a way to approach healthcare economies. For example, a doctor might actually prescribe a particular anti-malaria drug for a patient. The patient will go to a pharmacist, to get the prescription, to get the drugs. And the drug might be much, for example, the pharmacist might say that this particular drug is about 3,000. The patient say, oh, I don't have this money. Can you give me the same anti-malaria drug that costs less? And, we have a variety of anti-malaria drugs. The pharmacist may come down to, okay, this one costs 1,500. All these things, patients have rules they play, and they approach towards healthcare economics. Then the role of government, of healthcare providers, very important. Healthcare providers, while the patients serves as demand on the other side, we as healthcare providers, we serve as the supply. Yeah, the healthcare provider charges a fee that is dependent on the service the patient is seeking. This is very explanatory. The patient, you might decide, okay, you come with, For example, for those working in dental sector, you come with pain, you need to do extraction. Before that, you need scaling and polishing. You need your teeth to be what the patient will say, oh, I don't have money for scaling, no, just do extraction, let me go, maybe next time I will come back. The service that you render determines the price or the cost of that service. Then risk and insurance impact. Health insurance is a system that enables individuals to effectively seek for proper health care and manage their health at cheaper cost. This is very important. If you know that the place that you are working, you have health insurance, there are bills or there are small stipends that they remove from your salary. This will enable you to take your health very seriously, because you know that, okay, since they are removing 2,000 from my salary every month because of health insurance, it's expected of me that once I come up with headache, I should go to the hospital to run a quick check or a routine check of what actually is going on with my body. So this encourages health. Then benefit design. This is an effective means of controlling healthcare costs by forcing individuals to make more effective decisions about their care. Benefit design can come like maybe a particular organization will say, we discover that maybe for some time or for some months you've not gone on leave. Take a leave from work. They will give you money, your leave allowance, just a month, go and use it to rest, then come back. These are some of the ways that we can approach this. Then payment reform. This is a kind of motivation which can come as compensation to healthcare workers for their time and services in different ways. We see that especially during COVID-19, those people that were able to work during those periods, you see the hazard allowance, all these things, it serves as a way to motivate them, to compensate them for the work they are being done. Then, we should study health economics. Next slide, please. Medical providers, administrators, healthcare policy makers, then business leaders. Medical providers, for effective sake, medical providers must regularly evaluate new treatments, services, and technologies, and their role they play in ensuring that patients are given the best care. Just like I said before, the use of technologies, evaluate new treatments. Maybe these drugs was working in 1990, but things are now changing in 2000s, in 2020. So all these things, you evaluate new treatments, technology, things are coming up very fast. So as a medical provider, you should also be up to date in making sure that you give your patient the best care that they need. Then administrators, this set of people needs clear understanding of healthcare because they often deal with financial metrics than even the providers. Now, as much as we are talking about the providers, we are also talking about the administrators, because there should be a balance between those people providing the health and those people financing those providing the healthcare services. So they also need to be aware, they also need to understand how these things work so that they can keep the hospital afloat. In some part of the world, CMDs, or what you call the hospitals, are not being managed by the CMD, Chief Medical Director. They have management, but they have administrators that manage the hospital. And their goal is to make profit. So if they should make profit and keep the hospital afloat, even the NGOs, they should find a way to understand or to study the dynamics in healthcare economics. The healthcare service providers at every level of the society, local, state, federal, and international level, healthcare providers must walk a fine line balancing the public interest against various economic considerations. Yes, while making policies, there should be a balance. You are balancing the public interest and you're also considering the economic realities around a particular population. Then business leaders. In most developed countries, citizens receive health insurance through their employees. Yes, this is very important. As a business leader, you want your your workers to perform optimally, to perform at their best, to perform at their peak. So business leaders find a way to create the room for health insurance, which is very important because we have also noted that human functioning as the new way of thinking about health. When an employee functions well, when your employee is healthy, when he thinks very well, when he is healthy, he tries to bring more return in the business. So business leaders should find a way, to make sure that health insurance is being brought to their company. It's quite unfortunate that some of the companies or businesses we have around this part of the world, we have little or no health insurance. But in a sense society, in a more sense society, business leaders find a way, to incorporate health insurance so that those people that they employ can perform optimally. The importance of health economics. Yes. Health, it focuses on how economic behavior of stakeholder and experience affect the quality and the cost of medical care. It informs how people pay for their care. Yes, it also informs how you pay for their care and even why you pay for the care. It informs how those payments are being processed. Yes, of course. Just like we've been talking about technology. There has been a time that you see people, if you enter the hospital, people carry files. They carry this file to this place, carry this file to this place. No, they'll just send you there because they have already emailed your history. They have already cracked and emailed it to the next office you'll be going. So you are not going with that file. So all these things are the importance of health economics. Now, health economics inform how health system around the world can be structured, and improved. Yes, of course. Health economics can deliver insight that inform solutions to some of the world's most pressing issues, such as migration and displacement, climate change, pandemic, vaccine access, disorder, obesity, and also more. Yes, this brings an insight to inform solution to the world's pressing issues. Talk about migration, talk about people in the IDP camp. Are they not being careful? They are being careful. So health economists find a way to have a systemic approach to pressing issues within the society. In the case of pandemic, just like we know the one that just happened recently to COVID-19, how the world, there were funds, there were measures to tackle that. Even they started bringing on vaccines that make it possible for people to start living their normal life again. So health economics helps to do that. Then also, health economics apply economic theories to inform both the public and private sector on cost-effective solution to improve equity in healthcare. Yes, in as much as you are improving equity in healthcare, it should be cost-effective. You shouldn't overtask the members of the society. Then in conclusion, the needs for the basic knowledge on health economics can never be overemphasized. It cuts across different spheres of our lives and endeavors, both in maintaining adequate, effective, and optimal needs and means in which health needs are demanded and supplied. Therefore, awareness about health economics should be made available within the society, more especially within the academic sphere, as to enable students to get first-hand knowledge on the science of health economics and how their health needs are being met. More so, to be aware about the policies that can improve or mar their health and best means to prepare for it. Thank you very much. These are my references. I remain on my promise. Thank you very much for listening. Thank you for your time.
Thank you so much, Okpkwasili Amala Promise, for that interesting topic. I hope you find the session interesting too, our listeners. Can I hear your response? Did you find the session interesting? Hello, can anyone hear me? Okay, okay. Okay, that was an interesting presentation. Wow, health economics. This is the first time I'm hearing so much about this. And you can only get all this information from Oracle. Okay, thank you for joining us this morning, everyone. If you're joining us for the first time, this is Oracle. This is Oracle Community brought to you by Oracle. Oracle is an oral and public health organization incorporated in the Republic of Gambia. And the presenter today, Amala Promise Okpkwasili, is a member, Oracle College of Scholar. So our application is open. If you want to apply for the next cohort, do well to visit our website, www.oracle.org, and get all the necessary information. Okay, it's time for questions. I believe this presentation, it made us, we're just so keen. Let's know what this topic is all about. And here he delivered excellently. Thank you so much, our presenter, for this interesting and insightful presentation. It's time for questions. You can utilize the chat box to drop your questions. You can also signify by raising your hand emoji and you introduce yourself before you ask your question. Okay, you can also comment the presenter. You can do that in the chat box or you can signify. Okay, we have just few minutes to do that while we round it up for today. We have few minutes to do that while we round it up for today. Is it that the topic we discussed today is well understood? You don't have a question. Health economics, a system approach. Wow. Is it that you don't have a question to all those things he listed out? Honestly, it was an excellent delivery. Excellent. So we look forward to your questions. Our presenters are well prepared to tackle your questions. So bring it on. Bring it on. Bring it on. So for those of us that joined late, um, he mentioned he defined what health economics is. He said it's an applied field of study that examines and finds system-based solutions to make healthcare more equitable. A study that examines and finds system-based solutions to make healthcare more equitable, accessible, and affordable for all. You can agree with me that in our system today, healthcare services are not affordable. But what we do as an individual, as an organization, to make it accessible to groups, organizations, populations, communities that are undeserved, that cannot access and pay for our services. These are so many things he outlined. These are so many things he outlined in the principles and also the approaches. So if there are questions on how you can bring health economics down to your discipline, down to your profession, please go ahead and signify and ask your question, okay? Okay, while we are waiting for those typing to type, you can also drop your chat or you signify by raising your hand emoji. We do have our presentations every 2 weeks. So our next presentation, Orapo 39.0, please stay tuned and follow all of our social media handles. We are on Facebook as Orapo, we are on Twitter, we are on Instagram, we are on Thread, we are on YouTube. So if you need recordings of this presentation at the end of today, you can check tomorrow in our YouTube handle, and you will get the full and the complete recording. And if you also need recordings of past sessions, what we've been doing before, the presenters and the various topics we've talked about, you can do well to search for us on YouTube and get to listen to all of the presentations and the interesting topics that we've discussed so far. Okay, like I mentioned earlier, this is I'm sorry about that. Okay, yeah, like I mentioned earlier, this is full, and we can round it up. While we are waiting for the questions, though, without commending each and every one of us for joining us today, and also the convener of this community, Dr. V.E. Adamu, for giving us this platform, for giving back to the society through the Oracle community, you know and the ways where you can encourage us is to share and invite your friends and your colleagues to come and partake, to come and gain value, to come and listen. It is without a cost, so you should share freely and invite people. When you think about growth, it's not something that you can do alone. Invite people to come and listen, to come and learn, so that they can grow in their various fields and endeavors. So we ask that you help us share our flyers, invite friends to join the presentation today and in subsequent times. I believe that those of us that joined us today, you gained value. I know that, and this is how it is, and we keep improving, and the presenters keep improving too. So your questions, your encouragements can help them do more, so we look forward to seeing you in our numerous presentations. Mr. Samuel Arase, I commend the presenter for the insightful presentation. Thank you. Then Johnny said, thank you, presenter, for this wonderful presentation. It's my first time hearing this, and I added knowledge. More grace, sir. Thank you. Yeah, for some of us, it's our first time hearing this topic, health economics, a system approach. And I know that there are some institutions that offer these courses, health economics, but with someone that have little or no knowledge about this courses, be like, okay, but I can't go. I want to study medicine or surgery or any courses that when you say it out, people be like, yes, you're the one in school. Other people are not in school. So, but wherever you find yourself and whichever profession, make sure you're affecting your community. Make sure you're utilizing it very well to touch lives and to you know give back to the society, and then you know let there be a remarkable impact you're making in your community. Okay, so that is the essence of why we are here, so that in the next few years, maybe when we are no more, we'll be remembered for a particular thing we did. So that is the reason why we are here, and we should try as much as possible to know that. So wherever we find ourselves, as a medical practitioner, as a dental health officer, public health officer, make an impact in your world, make an impact in your society. There are so many people that are down, that don't know anything about health in your field. Educate them, take out time, even if you have to do it free of charge. Let it be something you do out of charity. Okay, and then even if you're going to do that for a fee, let there be organizations that can sponsor this program, and you see that so many people will benefit from this gesture. Thank you, Ogechuku. She said, well done, dear presenter. I learned from your beautiful presentation. Thank you. Thank you very much, everyone, for the commendation. Amala Chuku promised you delivered excellently, and it seems that we are all fed up, and like fed from the bottom pot. That means the lecture was awesome, and no questions for now. No questions. Okay, just for us to be notified that the chat box will also be open for questions in case if you're going through the presentation and you find that, okay, I've remembered that I have a question. Please, you can use the chat box. Our community is open at any time, at any day. We can discuss on any topic. We can, keep it engaging, make it lively. So, but please, no sharing of tips that are not useful to the community, no sharing of advert business without approval, please. So please make sure you stick to the guideline and to the principles and the regulations of the community. Make sure you don't default, okay? But we appreciate you for joining us this morning. Okay, without wasting so much of our time, I think we'll have to round up the session for today. Thank you for joining us once again this morning. I am Nguchika Charity. I'm a fellow Orapo College of Scholar, and I am your moderator for today. And I also want to thank all the fellows in the house that joined us this morning and other members of the college that joined us. And to our first timers, Dr. Kelechi Aniaboso, thank you so much, sir, for joining. You've been a devoted community member. Thank you also for joining us. I don't know the name, but it's signifying God's will. Thank you, everyone else, for joining. We really appreciate you, and we look forward to seeing you in many of our presentations. Thank you, Dr. V.E. Adamu, for giving us this platform. I can see that there are people typing. I'll just give them a few minutes to type, then I can summarize and then end the session. Thank you. But don't forget to drop your question when you remember any, and you can follow our social media handles. We are on Facebook, we are on Twitter, we are on LinkedIn, we are on Instagram, we are on Thread, we are on YouTube. Please do well to follow us. This is a way to encourage us and motivate us. Then share our posts, engage our posts, share it to your friends, and invite people to join our community. Thank you, and see you in our next session. God's will, thank you all. Keep up the good work. Thank you, NIFA Nojo. We appreciate every one of you. Thank you very much, and do have a wonderful weekend. Bye.